In this presentation, we will discuss research design. Now, in our last mini lecture, we talked about the various methods of measuring behavior. But measuring behavior is only one part of conducting research. You must also determine how you will design your study. And this allows you to see how different variables affect the behavior that you're studying. So we'll be discussing two major types of research: descriptive research and experimental research. With descriptive research, you're only describing a behavior and the situation in which that behavior occurs. You're not manipulating variables. You're not changing anything. You're not making the behavior happen or not happen. You're simply describing the behavior and the situation in which the behavior typically happens. It includes things like surveys, where you're just asking people to report on their own behavior or their own characteristics. Case studies. This is where you do an in-depth study of one individual or a small number of individuals. So you may have the people take surveys, you may interview them, you may look at old documents relating to that person, you may interview people who know that person or knew that person, but again, you're just collecting information and describing the information that you collect. You're not changing anything, you're not manipulating any of the variables. Descriptive research also includes naturalistic observation. So this is where you're observing somebody's behavior, you're not intervening, you're not affecting the behavior, you're simply observing. The pros of descriptive research are that it provides very rich, detailed information about behaviors and the setting in which the behavior occurs. You're watching people behave naturally, you're collecting information, and it gets really rich descriptive information about the case you're studying. The cons of descriptive research are that you cannot imply cause and effect. You cannot say that one variable caused the change in the other variable. So for example, let's say you're doing an observation. A person falls and another person laughs. You could conclude that the person falling caused the other person to laugh, but you really can't say that for sure. What if the person who laughed was thinking of a funny memory? So descriptive research does not allow you to say that one thing caused another. You see this a lot with correlational research. So correlational research is a descriptive research method. You're simply collecting information without manipulating that information. So take the study that came out many years ago about marijuana use. And this was a correlational study. They took hardcore drug users, people who use hardcore drugs, and they asked those people, did you use marijuana as a teenager? And the majority of the people said, yes, they did. So this study concluded that marijuana usage causes hardcore drug usage. And again, this is descriptive research. You cannot make those types of inferences about cause and effect because there are so many other factors that could have caused their hardcore drug use other than the fact they did use marijuana as a teenager. And to show you how you can't apply these types of things with correlational research, if you ask those same hardcore drug users, did you drink milk as a child? The vast majority will say, yes, I did drink milk as a child. You wouldn't then conclude that milk drinking causes hardcore drug use. And so by the same token, you can't conclude that using marijuana causes hardcore drug use in later life. So that was descriptive research. The other major type of research is experimental research. Here you manipulate an independent variable to determine the effect on the dependent variable. So here, the experimenter changes the independent variable to see how it affects the dependent variable. So let's say you're looking at the question of how does Instagram usage affect grades? The experimenter might assign people to either not use Instagram at a moderate rate, use Instagram at a high rate, and see how those groups differ with regard to their grades. So there they have manipulated the independent variable of Instagram usage. This type of experimental research or experimental research overall does allow you to determine cause and relationships. Because you are controlling and changing the variables yourself, you can control them such that you can say that one thing does in fact cause the other. So within the area of experimental research, we're going to look at two types of designs: group designs and single subject designs. So group designs are research on large groups. Single subject designs are research designs that involve either one participant or small numbers of participants. So the first type of experimental research we'll talk about is group designs, specifically control group designs. Here, participants are randomly assigned to either the experimental group or the control group. The experimental group is exposed to some type of intervention. The control group is not exposed to the intervention. At the end, you compare the control group and the experimental group on whatever your outcome variable is. So if we take our diagram here, you're starting with a sample of people who do not have jobs. So here in the first circle, if people are out of work, you randomly assign those people to two different groups: the experimental group on top and the control group on bottom. So here, again, all the people in each group do not have jobs. You then expose the top group, the experimental group, to some type of intervention. So let's say it's a job training intervention. The control group is not exposed to the job training intervention, so they get no intervention. At the end, you'll compare the two groups on their ability to find a job. So you see the top group, the experimental group, has more people in green, people who've been able to find work, as compared to the control group that has fewer people in green who found work. So again, experimental group gets some type of intervention, control group does not, and then you compare them on some outcome variable at the end of your study. The pros of group designs: they do allow you to determine cause and effect. You can say that, for instance, your job training intervention did cause more people to get jobs. The cons of group designs: you do need a large number of subjects. You have to do your experiment on a large number of people, and the more people in your experiment, the more confident you can be in saying that one thing caused the other. When you have a small number of people, you can't make those kinds of conclusions with as much confidence. The other con of group designs is that they focus on the average, not the individual. And this comes up a lot of times when you talk about things like spanking. So in studies of thousands of children following them over periods of years, it's clear that spanking does not lead to long-term behavior change. And typically, children who are spanked are more aggressive than children who are not spanked. And we'll talk much more about this research later. But people will always say, well, I was spanked, it changed my behavior, and I didn't become aggressive. And that is the thing with group designs. When you look at large number of people, I can say on average, children who are spanked become more aggressive than children who are not spanked. I cannot say for one individual child, spanking will be aggressive. I cannot predict that based on this type of research. But I can say when you look at large numbers of children, on average, this will be the result. So again, it's good for making predictions when you're looking at large numbers of people, not for predicting individual results. Take a medication. I can say this medication is tested on thousands of people. On average, people do tend to respond to this medication, but I cannot say from that for you, this medication will be effective. And the final con of group designs is you don't analyze or interpret your data until the end of the experiment. So you have to wait until all the data has been collected to draw conclusions. It doesn't really allow for analysis or interpretation of data as the experiment is progressing. So the other type of experimental research is single subject designs. So again, this involves either a single participant, a single subject, or small numbers of participants. The first type is the simple comparison or the A-B design. Here, you measure behavior at baseline, meaning you're measuring the behavior without any intervention. You then implement an intervention, and you see if that behavior changes as the intervention is implemented. So looking at our chart here, you're looking at the number of cigarettes smoked per day. So you're collecting baseline data from day 1 until day 7. So you're counting the number of cigarettes a person smokes each day with no intervention. On day 7, you're introducing some type of stop smoking intervention, and you can see that from days 8 to 14 with the intervention, the person's smoking does decrease. Now, the problem with the simple comparison or the A-B design, it does not clearly allow you to determine cause and effect relationships. And the reason for this is it does account for the possibility that some other factor caused the change in behavior. So with this example of the stop smoking intervention, what if on day 7, the same day the person started the stop smoking intervention, that person caught a cold? And because they were not feeling well, because they were congested, they reduced the number of cigarettes they smoked per day. So if you see that, you could conclude that, oh, our intervention is effective. It lowered the number of cigarettes this person smokes per day. In reality, it was just the fact that the person happened to catch a cold on the same day the intervention was implemented. So you can't really clearly say cause and effect with this type of design. Now, the reversal design accounts for this issue that you have with the simple comparison design. So simple comparison was an A-B design. The reversal design, A-B design. This means that you alternate between the baseline and the treatment conditions. So looking at our graph, day 1 through 7, you're collecting or you're observing the number of cigarettes the participant smokes each day with no treatment. On day 7, you implement the treatment. You see that the smoking goes down. Day 14, you remove the treatment. You see the baseline. You see that the number of cigarettes goes back up. And then on day 21, you implement it again, and you see that the number of cigarettes smoked again goes down. So this does allow you to determine cause and effect relationships. If each time you give the intervention, the behavior decreases, each time you remove the intervention, the behavior increases, you can see that clearly the intervention is causing the change in behavior. Now, this does not work with treatments that have long-lasting effects. You have to be able to remove the treatment in order to determine whether or not that treatment is effective. In some cases, if the treatment has a long-lasting effect, you cannot remove it and expect the behavior to go back to baseline. So let's say you were testing the effectiveness of some particular drug, but that drug stays in your system for 30 days. You couldn't then measure the behavior before the medication is given in baseline, give the medication for 7 days, and then remove the medication and expect the behavior to go back to the baseline rate because the person still has the medication in their system. So the treatment is too long lasting for this particular type of design. This also does not work for some like educational interventions. So if you taught a person a skill, it's hard then to, remove the treatment and have them, they wouldn't unlearn the skill and then teach them the skill again. So the lingering effects of the intervention wouldn't allow you to do the reversal design, wouldn't allow you to withdraw or remove the treatment. The other issue with this type of design is that removing the treatment can be unethical. So think about if you were testing a cancer drug. You measure the person's, tumor size or cancer rate before the medication is given. You give the medication, it's effective, it shrinks the tumor. Then it would be unethical to say, well, we're going to remove this treatment to see if the tumor begins to grow again. It would be unethical to remove what you have found to be an effective treatment. Multiple baseline is another single subject design. Here, you institute a treatment at different points in time for either different people, different settings, or different behaviors. So you can have multiple baseline across people, multiple baseline across settings, or multiple baseline across behaviors. Across people, you'd be looking at the same behavior for 3 different people. So let's say you're looking at the behavior of smoking for Jennifer, Jason, and Paul. For Jennifer, you would measure her smoking at the baseline condition, let's say for days 1 through 7. At day 7, you give her the stop smoking intervention and her smoking drops. Jason, you keep in baseline, meaning getting no intervention for smoking until day 14. At day 14, you give him the intervention, and you see at day 14, his smoking behavior decreases. Paul, you keep in baseline until day 21. Day 21, you start implementing the intervention for Paul, and you see that his cigarettes smoked decrease at day 21 when the intervention is implemented. So that's multiple baseline across people. You can also do multiple baseline across settings. So maybe you're looking at the smoking behavior of Paul, but you're looking at smoking at home, at school, and at work. So you keep them in baseline at home until day 7, and then implement the stop smoking intervention on day 7 for home. Keep them in baseline in the school setting until day 14. Keep them in baseline in the work setting until day 21, and then you implement the intervention for smoking at work. And if on day 7 you see his smoking at home decrease, day 14 you see his smoking at school decrease, day 21 you see his smoking at work decrease, then you can say that this intervention does work, because in each setting, when the intervention is applied, he decreases his smoking in that setting. You can also look at multiple baseline across behavior. So the same person, but different behaviors. So maybe you're looking at Paul's behaviors of smoking, cursing, and nail biting. So you would start the intervention for each one of those behaviors at different times. And so if his cursing decreased when you start the intervention for cursing, a week later, if you start the intervention for cigarette smoking and it decreases, and then 7 days later you start the intervention for nail biting and that decreases, you again can say the intervention is effective. So this type of design does allow you to determine cause and effect relationships. You can say that the intervention caused the decrease in the behavior, and you do not have to withdraw the treatment to determine the effectiveness of this treatment. So that's another pro, that you can show that something is effective without having to withdraw the treatment like you do in the reversal design. So the last single subject design we'll talk about is the changing criteria design. And with this type of design, the effectiveness of a treatment is determined by how closely the behavior matches some criteria. So here you look at the behavior in the baseline state, you measure the behavior, and then you establish certain criteria or certain goals that a person has to meet in order to move to the next level of changing that behavior. So looking at this chart, we're measuring number of cigarettes smoked in baseline until day 7. Day 7, we start our intervention, and we establish then that the person can smoke at maximum 16 cigarettes a day. So we have our criteria across the top of our graph here. So once the intervention starts, we set a criteria of you must smoke 16 or fewer cigarettes a day for 3 days. If you meet that criteria, then we reduce it to 14 cigarettes or less a day. If for 3 days in a row you meet that criteria, you smoke 14 or fewer cigarettes for 3 days in a row, then we again reduce that and set the criteria at 12 cigarettes or fewer a day. Meet that criteria for 3 days, then we reduce the level again. So the criteria are systematically altered over time. And this is good for gradual behavior changes. You want to slowly reduce the number of cigarettes you're smoking. You want to slowly increase the amount of time you spend working out. So this is good for those types of gradual behavior changes. So the pros of the single subject designs, it can be done with a single subject. You don't need hundreds or thousands of people like you do with the group designs. So it could be more feasible, it could be more economical to do this type of research since you're dealing with far fewer people. You can determine effectiveness for an individual. Like we said with the group designs, you're looking at large numbers of people, so I can say on average this treatment is effective. But I can't say for a particular individual. The single subject design allows us to say this treatment is effective for this particular individual. And you may not need stats to analyze the results of this type of research if the differences are big enough. If when I implement the stop smoking intervention, your cigarette smoking goes from 20 cigarettes a day to 5, and then I remove the intervention, your number of cigarettes smoked goes back up to 20. I again give the intervention, and your number of cigarettes smoked goes to 2. I can clearly say without doing any stats that my stop smoking intervention is effective and lowers the number of cigarettes you smoke per day without doing any stats. The cons of some of the single subject designs, which you've already discussed. Some of these designs are inappropriate for long lasting treatments. With the reversal design, if the treatment cannot be removed, you cannot really prove that it's effective because the person's behavior will not return to baseline. And finally, some types can be unethical because it involves withdrawing treatment. It would be unethical to remove a treatment for somebody that is working effectively.